because the World Mental Health Day this year is talking about suicide prevention, mental health promotion. But from people in Taiwan, we also discuss the issue because always from September to October, always we have a mental health month. But from suicide prevention, maybe it's not enough. Like we have in our June 18, just like we mentioned, we passed the mental health prevention law. It's good because they take the 1925 become a short telephone number, so it's easier to you remember and you call for help. However, when we look at those kind of law, special for some special problem, it's a problem oriented. It's not really mental health promotion part. So still we need to have more activity or more promotion. That's why we need to have Mental Health Promotion Act. That is very important because we need to have umbrella. Then you can mental health you can have the suicide prevention. You can have the violence prevention, family violence law, prevention law, or some disaster. After disaster, you have disaster mental health issue. Yeah. So we need an umbrella for Mental Health Promotion Act. So we have the legislator people, congresswoman. So I think that will be, we are working on that. So we're talking about our slogan will be tackle the suicide, initiate Mental Health Promotion Act. So this is our slogan for that. So we hope our government can have the Mental Health Promotion Act actually start to take action and thinking about the content. And I also like to share with all of you, and maybe one day, every country also can be. So GAMHA or WFMH all can have those kind of situation. So this is also a little bit of regret. We like all the department, cross minister, all have emphasis on mental health promotion. Yeah. So this I think is our promotion, our issue for the World Mental Health Day.
All delegates from all countries, and this time we want our beyond trauma, we can do some creating our resilience, and we can do prevent our suicide, and for our young children and our in school or in our community and workplace, and also our disaster about 20 years ago, the 9/21 earthquake. And this time, we need some law for our mental health promotion and advocacy. I think it's very important for us. And in Taiwan, we have just passed the suicide prevention law in this May. And this time, we want to, the prevention is much beyond the suicide trauma, and we can need do some more, and from early stage, from young child to from family to the community, and from parents and to everybody. I think it's very important, and welcome everybody come here, and you can eat your mailbox and take easy. And we can just start, and then we can talk free, because we just 30 minutes. 30 minutes to this. Okay, thank you.
Suicide affects every country, every community, and family that has been affected. So, World Mental Health Day, we normally say we celebrate, but this year we want to commemorate, because there are so many lives that have been lost. Every 40 seconds, someone dies by suicide. 800 to 1 million people will die by suicide this year. The second lead cause of death amongst our young people, 15 to 29 years old, is by suicide. And this definitely calls us to really focus on how we begin to discuss suicide and put in place preventive measures. So the World Federation for Mental Health, it's actually a project of the World Federation for Mental Health. And we felt that this was an important focus for the world because of this crisis that we face. And it is an opportunity for all of us, everyone, everywhere, to raise awareness. It's an opportunity for us, everyone, everywhere, to start changing the conversations and to start putting in place programs that allows people the opportunity to open up, that we give back hope. For every life lost, we lose human potential. And by focusing on suicide as an awareness and also prevention campaign, we are saving lives. And so this is a very serious matter for us. And we want to draw the attention of the entire world. And the entire world, the World Health Organization, United Nations, and every other mental health, global mental health body and movement has focused on mental health promotion and suicide prevention. It allows the global community and as citizens of the global world for all of us to come together and to focus on the subject so that we can start putting in place safety nets for people. Safety nets that allows people to come out, talk about, and that we can give back hope. And as I said, in so doing, harness potential, save lives. Thank you.
Our lives and in fact, everything that we do on a day-to-day basis, including our mental wellness and mental diseases, are affected by culture and expectations. And when we come from Asia, there are certain taboos and also sensitivities that we have to deal with. If I were to share with you that there was a senior person, an elderly, who came into the emergency department and she actually cut her tongue with a pair of scissors, thinking that it was a way that she could kill herself, thinking that this is a way to commit suicide. Our Western counterparts may not understand that this is something that probably the Eastern culture have an understanding of. Perhaps it's a misnomer and a misunderstanding that if you slash your tongue, you can actually commit suicide and you can die. So therefore, we have to understand the sensitivities of the culture in which we live. So therefore, when talking about suicide, which is a taboo subject as well, we should be able to explore this. If you can create the awareness, the ability to have conversations with others, whether they are young or whether they are seniors, that would be the best and the most important starting point. So therefore, the incidence of suicide across all nations, Asian and Western, is increasing, not just in the younger generation, but also in the seniors and the older generation. I think the prevalence and the incidence that is calculated across many nations will showcase that as well. So therefore, it's important for us to highlight this any way we can. In fact, in the parliament in Singapore, we have also asked questions about the number of suicides, the age groups and the age ranges that are affected, for example, so that we are aware. These figures are made public and so that people can use it as a starting point for conversations. For World Mental Health Day every year, we celebrate in different ways. And it doesn't have to be a costly way to celebrate because we use this model called a partnership model. We can work with community groups, with NGOs, with governments, with schools, with the community, and with the community centers in Singapore. We have a big carnival, a big fiesta, and so on and so forth. Just events and platforms where people can come together to create awareness, to not be shy about asking questions, to check the state of their mental wellness, and to be able to come forwards. We have many exciting programs we've done over the years. For example, we had a program where all of us had to participate and sit down quietly and not do anything and let your mind go free and see who can last the longest. I lasted for all of 8.5 hours. That was one of the programs for one of the mental health weeks a few years ago. And the record was at 10.5 hours. This is to inculcate some mindfulness, for example. For this year, we are doing a program which is linked to charity. We have a Wheels on Love program, which is actually working with the motorcycle groups in Singapore, whether it's Harley Davidson or whether it's any of the other models of motorcycles. They are coming together to do mental awareness. What we're doing is we're going to ride on the motorbike. I'm going to be a pillion rider. I don't have a motorcycle license. And we're going to go to Institute of Mental Health, which is the institution for mental health, wellness, and also treatment of diseases in Singapore. It is a large institution. It's a 200-bedded institution, and we're going to do programs on awareness, entertaining some of the clients there, working on programs and bringing young people and also adults to this. And this is one of the programs that we're going to do when I go back from Taiwan. And this has been linked together with 2 seminars which we have done for the motorcycle groups the last 2 weeks for creation of mindfulness and mental awareness, and so that they are aware about what they're going to encounter when we do this program this year, for example. We are also having a big carnival organized by the Institute of Mental Health this year. And in fact, there are many, many other programs in all the other constituencies. So small as they may be, in each of the 90 constituencies we have in Singapore, but the awareness that we can create is important. So use every single platform to help mainstream mental awareness, mental health promotion, and also to get people talking and having conversations about this, because this is the most important starting point. At the legislative and policy level, if we have got representatives who can bring this up in Parliament, talk about it, get the numbers, get the figures, get the statistics, be the role model or the ambassador who can come out and tie your face or your figure to talking about mental wellness and mental health issue, that will probably be a good starting point for any country. Thank you very much.
It's my pleasure to be here with all of you. And I learned a lot from all speakers in this morning, especially how to promote health students, mental health in school. Because I'm in the education and the cultural community in the legislative yuan, and I work for NGO for more than 20 years. So now I'm in the parliament. I also concerned, my major concern is children's rights. So it's thank you for all of speakers sharing.
Hi, my name is Maria Brandau, and I'm from Lundberg. We're really proud to be here today and to be able to support the conference, and congratulations for a fantastic organization of bringing so many people together. With regards to World Mental Health Day, I would just like to commend the tremendous work from the communities and from all the organization around the room, and in particular the World Federation for Mental Health, for really driving the agenda on mental health promotion and really trying to get the 10th of October, the 10th of the 10th, out there throughout the world. At Lundbeck, we're really committed to this day. A few years back, we didn't have many initiatives happening in our countries where we're present. I am proud to say that this year we will have 51 countries around the world in Lundbeck offices taking the lead with World Mental Health initiatives worldwide, from Mexico to Pakistan, from Brazil to Japan, from European countries, and it's really something that we're really humbled to be able to be part of. So thank you, everyone. I think everybody would deserve a round of applause for the fantastic work.
I'm from Pakistan. I'm also a life member of the World Federation of Mental Health, and I was the Vice President for the Eastern Mediterranean region for 2 consecutive periods. I just wanted to, we've established a section on women's mental health in World Federation of Mental Health, and I just wanted to mention, in my particular region, there is a very high suicide rate in women also. And in the Asian women, especially India, Pakistan, and other places, there's a lot of in-laws problem, the family, extended family, etc. And women, there were stove burns, which is now, thank God, ended. But still, suicide rate is fairly high in women and young girls who are forced to marry against their wishes. And of course, as you just mentioned, a little bit, people just mentioned that Pakistan is one of the leading country which has had celebrated the World Mental Health Day almost in all the cities, large cities of Pakistan, and Lundbeck has been very supportive. So we'd like to thank you for that. But I must say this, under the banner of World Federation of Mental Health, this particular event, the World Mental Health Day, has been actually started, I understand, from Nancy Welles by the World Federation of Mental Health, and which we forget quite often. And it is one of the greatest achievements of World Federation of Mental Health, and hearing all the special things. I think we are here, as you said, we should do more and more, but I think we are reaching there. We are all together and seeing all the galaxy of people around. So I have great hope, and seeing your, especially the film, was very interesting. Thank you. Thank you very much.
Yeah, I'm Tan Cho Chung from the Philippines. Yeah, I'd just like to say, I think late 2017, even though we are a bit late, but it's already a law. In other words, everybody is entitled to have mental health, okay, and the rules and regulation, and the emphasis on the human rights in the mental health law. Okay, that's one. And then early this year, the universal health law was also passed. So in that law, there was also an emphasis on the mental health. And for your information, the Asian Institute of Spirituality in the Philippines, next week, there will be a seminar on suicide. So we would like to welcome everybody to join a one-day seminar on suicide. If you're interested, please let me know. Thank you.
Hi, it's my pleasure to be here. And in Thailand, we have a big organization as a Department of Mental Health under the Ministry of Public Health to responsible for the mental health for Thai people. And we celebrate the Mental Health Day every year. And this year the theme is Talk to Me. ME, the very capital one, it means the mental health education. And we invite our celebrities, our actors and actresses to the seminar and talk about, what is the mental health on the film. So they will talk about that. And we just have anti-stigma awareness to the public. Recently, we have arranged the running. We call Crazy Run. And we got about 5,000 participants in that event. And we got one celebrity that he said that he would like everyone to think that mental health is everyone's issue. So he came to our psychiatric hospital and he want to rebrand our hospital. And he made a t-shirt, and on the t-shirt said that I am from Srithanya. And it is, less stigma. Everyone in the country right now, they wear this t-shirt, I am from Srithanya. So these are the activity in Thailand. Thank you.
I'm honored to be here with Professor Chang for inviting us. This is actually my first opportunity to be exposed to the mental health issues. So I would like to, looking forward for another, for the future, any organization that's, really trying to pull us and then become an alliance to combat about these mental health issues. But from Malaysia, actually, we are struggling because the allocation, we have very little allocations on prevention and promotion. They always focus on treatment. I suppose everybody also is facing the same thing, but because of that little budget, and our focus on mental health is also very little. So that is an issue for our country. And it's just that last year we have new government which also focus on mental health. That's something that we need to celebrate, So we're also going to have this launching in October 17th on the mental health campaign, awareness campaign, which I actually, we call it Let's Stop Minda Sehat. Minda Sehat is actually mental health. And we will have this a long-term awareness campaign. Malaysia is not really focus on awareness only, because they're saying that they cannot see the impact. They always say that, okay, this campaign is a hooray thing and they cannot see the impact. So the allocation is so much, I think that's not a priority for the country. So I hope that we can change the mindset. We have this paradigm shift, not only as Mr. Farouk said on the setting, but also the mindset of our top leaders. Thank you very much.
It has grown amazingly over the years. We are very, very proud of what we've created. Along the way, we have reinvented World Mental Health Day. We have, as you can see, our new logo we started last year, which we are very proud of, and we would like everybody to use it. Keeping everybody together, the unity and the empowerment that we have when we're focused on the same campaign moving forward. And we do so much with a lot of help from our wonderful funder. On social media, we are reaching millions of people. We want everybody to join in, spreading the same message. Again, we have a lot of assets and a lot of pictures and statements that we put out daily on our social media. We have created posters and banners and the logo in 16 different languages now. Everything is on the website, and we really love hearing back from everybody about the events that they have. We try to post those. We are going to work on, in the next year, being able to have people report back to us on our website about like events that they've had, and we love seeing it, and I know the world loves seeing what other people are doing. So we are very actively involved in getting information out to you. We also want to hear back from you, and we love any event, whether it's parading down the street or handing out brochures or having a meeting, anything that you can do to bring awareness and to focus on the theme that we create every year is wonderful. So we appreciate everyone's support and anything that you can do to help spread the word.
Thank you very much.